A pharmacy is a place where you can get medicine. It can be in a hospital, a part of a store, or its own business. At the pharmacy, you can get two types of medicines, one called over-the-counter, and the other is called prescription. Over-the-counter medicines are found on store shelves and are used to treat small health problems. Some examples are medicines for small colds, cough, headache, stomach aches, and pain. For these types of medicine, you do not need the doctor to write you a note called a prescription. You have to pay for over-the-counter medicine with your own money. During your doctor appointment, it is important to tell your doctor all the medicines you are taking, including herbs. A doctor may recommend taking certain medication to help manage your health, so they will write you a prescription. Prescriptions are medicines that you can only get if your doctor writes you a note for it. The notes can be sent to the nearest pharmacy to your home by the doctor, or sometimes you will have to take the note to the pharmacy yourself. If the doctor gives you the prescription to take to the pharmacy, you will have to wait at least 1 hour before it is ready. Your medication is intended to help you manage your health and plays an important part in you getting well. Your doctor will write on your prescription how much and how often you are supposed to take your medication. It is important to take your medication as directed by your doctor. By doing so, you can prevent a possible visit to the urgent care or emergency room. Make sure to ask questions about the medicine if you are unsure about anything. Do not share your prescription medication with anyone. It is only for you and your specific health condition. Giving it to someone else, especially children, can be very dangerous. Before you get your medication, you will have to give the pharmacy clerk your prescription, your health insurance card, and a photo ID card with your correct name, date of birth, and address. If you have not received your photo ID, you can give them your RMAP card. If you do not have your insurance card, tell the clerk of the name of your insurance company and your insurance ID number. The clerk will enter your information in the computer and let you know how long you will need to wait to pick up your medication. It can take an hour or more before the medicine is ready. Sometimes they may not have the medicine you need that day, and it can take the pharmacy a day or two to get it. All pharmacies have access to medically trained telephone interpreters. It is important to tell the pharmacy what language you are most comfortable communicating in, so that they can call an interpreter for you and you can both understand each other. You can wait in the waiting area until your medicine is ready, or you can come back later. When you come back to the pharmacy and your medication is ready for pickup, the clerk will ask for your first name, last name, and date of birth. This confirms your identity and ensures you are receiving the correct medication. Let the clerk know you need an interpreter and the language you speak. Once the clerk scans your medication, you will have to sign your name confirming you have received your medication. The clerk will ask you if you have any questions about your medication or if you require a consultation. If you have any questions about your medication, you can ask the pharmacist, a licensed healthcare professional who can provide you with detailed information about your medication. Some medications may have some form of a side effect, which is a change in how your body responds when you are taking medication. This can be sleepiness, nervousness, feeling sick, or other feelings. Speaking to the pharmacist will help educate you on what symptoms to look for when taking your medicine. Call your doctor if you are feeling some side effects to make sure everything is fine. Medication is most effective when taken as prescribed. It is important to follow recommendations on how much of the medication to take and how often you need to take it. When your doctor tells you to take your medicine once, twice, or every 6 or 8 hours, pick a time during the day to take your medication every day thereafter. If you should miss a dosage, follow the instructions from your doctor or call the pharmacy for assistance. This will help prevent any potential health problems. During a pharmacy consultation, you will learn what medication to take for a specific health condition as directed by your doctor. The pharmacist will also inform you of when to take your medication, whether or not to take your medication before or after you eat a meal, and what not to eat or drink while taking your medication. If your health should become worse after taking your medication, you can contact the pharmacy, your doctor, or 911, depending on your symptoms. The pharmacist will educate you regarding different symptoms to pay attention to and when to call 911. If you have additional questions about your medication, be sure to inform the pharmacist during this time. Your doctor may prescribe a 30-day supply of medication for you. If you are out of medication and your doctor approved refills, you can call the pharmacy to request more medication. Your insurance company will pay the cost of your prescription for the length of time your doctor requested. If you run out of medication before 30 days, your insurance company will not pay for your refills until after 30 days of taking your medication. If this occurs, you will need to speak to your doctor. The doctor may be able to speak to your insurance company and request a refill before the 30 days, depending on your health condition. Your medication bottle will list the phone number to the pharmacy and the identification number for your medication. When you call, follow the instructions from the automated voice. Although the automated voice is in English, you can press 0 to speak directly to a clerk. Say the word pharmacy, and the clerk will transfer the call to the pharmacy. Once the pharmacy is on the phone, say the name of your language to inform them a language interpreter is required for the call. Once an interpreter is on the phone, provide your first name, last name, and date of birth, and the name of your medication you need refilled. Recap. A pharmacy is a place where you can get medicine. It can be in a hospital, a part of a store, or its own business. Over-the-counter medicines are found on store shelves and are used to treat small health problems. You do not need a doctor's note or prescription for this medicine. Prescriptions are medicines that you can only get if your doctor writes you a note for it. The prescription note can be sent to the nearest pharmacy to your home by the doctor, or sometimes you will have to take the note to the pharmacy yourself. Some medications may have a side effect, which is a change in how your body responds when you are taking the medicine. Some examples are sleepiness, nervousness, or stomach aches. Call your doctor to make sure you are okay if this happens. It is important to ask the doctor or pharmacist how to use any medicine properly, including if you have refills. Ask for an interpreter if you need it. Do not share your medicine with other people. It can make them sick or it can be deadly. Do not give children the medicine that you take. There is medicine made specifically for children.